These are what we call helpers. The first layer of support are peers who have exhibited engagement and helpfulness level that really sets them apart. We're able to identify them. They get a helper badge, which is visible to other people on the platform. And every conversation ends with the non-helper being given an opportunity to rank the quality of the conversation.
Hi, this is Soumya, and you are listening to Loneliness Busters, a podcast where I talk to founders, researchers, policymakers, investors, community builders, and more on how to build a more connected world. I hope you join the squad. We need all hands on deck now more than ever. Hi, everyone. I'm excited to have Boaz with us today. Boaz is the founder and CEO of Wisdo Health, a leader in providing social health solutions to those who need it the most. Wisdo provides AI-driven peer support communities where people can engage in secure, confidential, and anonymous conversations to foster emotional support. Since launching in 2018, Wisdo has connected over 1 million Americans with people who have been in their shoes, have provided trained services to offer loneliness-reducing interventions, and also provide clinical referrals when people need it the most. Prior to Wisdo, Boaz was an award-winning novelist, playwright, and journalist. He's a graduate of London School of Economics. He's an author of 7 produced plays, 2 novels, and 3 nonfiction books. He received a Fullbright Award in recognition of his work in theater. Wow. Boaz, welcome to the pod.
I'm blushing. Thank you for that very generous introduction.
Oh, I just said what you've done in your life. Thank you for all your contribution. There aren't very many journalists and novelists who end up in the health world and become founders. Share your story with us. Where do you come from and how did you end up here?
Happy to, and thank you for inviting me, and thank you for being on this mission to wrangle us loneliness busters to try and solve what I think all of us view as one of the biggest challenges to healthcare in the US and worldwide. I started my journey into trying to solve this problem or helping solve this problem, as you said, as a journalist. I grew up in Israel, spent most of my career as an investigative reporter, as a correspondent for one of the largest media organizations in Israel, in London and in New York. And really my kind of journey into health was when my dad, who was a very well-known businessman here in Israel and also the president of the Israel Cancer Association, got diagnosed with cancer 2 years into his term as president of the ICA. We, as many other people, naively thought that it would be very easy to find support and share a story and alleviate this strong sense of loneliness and lack of social support. And for 8 long years, we were continuously disappointed by the solutions that are out there, mainly social networks, in providing that sense of support and in connecting us to people who could A, be relevant, B, could be helpful, and C, would be available. And it was also a matter of kind of aligning these three things. And it was very difficult, very time consuming. And when my father unfortunately passed away 8 years after he was first diagnosed, I did what angry journalists do, which is write a 12,000 word article for the paper that I worked for, essentially asking how is it possible that this illness that tens of millions have gone through in the past is really good at producing protocols that look at the clinical journey, but there are absolutely no clinical journeys for the 95% of being a patient or a caregiver, which is the mental health toll, the financial toll, the what it does to the family, et cetera, et cetera, et cetera. So that is really how this started. And really the backlash for that article was pretty um, amazing because I started getting dozens and hundreds of calls from people who essentially said, "We really want to talk to you because you've been there." And my immediate response is, "What do I know? I'm just a journalist. I'm not a doctor. I'm not a physician." And it very quickly became clear that's not why they're calling. They're not looking for clinical advice. They're looking for support from someone who's been in their shoes wants to help and seems to be available to help because he took the time to write the story. So that is really was the genesis of this. Very quickly, within a few months, it became clear that I won't be able to do this with a phone and that maybe tech can come in and produce something that would solve this very fundamental question of how do you get better at connecting people to specific people? And then how do you measure on a monthly basis whether the connections that you're providing actually are improving social health, mental health, and subsequently physical health as well? Found a group of folks who are engineers, AI folks, R&D is fairly strong in Israel. And that is how Wisdo came about.
Um, it's very strange. I didn't know your story before today, but it's very parallel to actually what I've gone through in the last 6 months. I wrote up an article because I was fed up, and as a mother, I was like, I don't want my kid to grow up in a world like this. And a lot of times, people think that, oh, it was my article. It wasn't really. It was just the right time, and I wrote something that a lot of people were feeling, and a lot of people
Mhm.
resonated with the problem. But thank you for taking the baton. I think it takes a lot of courage and also a lot of empathy. So tell us a little bit about what Wisdo does. Is it an app? Is it a service? What's the company's philosophy and mission?
Happy to dive into that. Sure. So yes, we're a software solution. So we're a digital health company available to members through an iOS, Android, or web app. Our clients tend to be mainly very large healthcare organizations or employers who are concerned by the loneliness epidemic and what it means to people's health. And what we do is we curate personalized, tailor made peer networks around people who join, invite them to indicate where they identify the biggest gaps in their social support network, which is, by the way, one of the best ways to define loneliness. It's essentially a gap between the human networks that you would like to have access to and the ones that you have access to. So we invite people to indicate where are the gaps. We then map out specific triggers that are increasing instances of loneliness within those experiences. And then we use that data to continuously recommend to them people who've been in their shoes, who have joined with, and who can be supportive to them because they answered the two criteria. One is, again, there's a high degree of similarity, which has shown repeatedly to be the main accelerator of loneliness reduction, affinity, finding emotional support, finding a sense of belonging. All these are brought about by talking to someone who can say, I've been there. I understand what you're talking about. Let's have a meaningful conversation. Then the second criteria is helpfulness. So people are ranked by how helpful they've been to other people on the platform. So that is the first problem that we're solving through the platform, which we believe is one of the biggest reasons why social support and social health hasn't been solved at scale, which is, again, as you said, a lot of people are lonely. A lot of people wanted help, but how do you connect the right person with the right person at the right time to kind of move them in the right direction? So that's one thing that we do. The second thing that we do is assessment. So I think the second challenge that social health, social support solutions haven't always been good at producing is data. How do you make sure that if you are providing any sort of intervention that is meant to influence social health, that is in fact what is happening? And from a business perspective, very frankly, and all of us are companies who want to grow and help more people. How do you translate that data to something that would be meaningful to a large health insurance company or a large employer or state or a government agency? So we came up with an assessment, which is something that we've worked on with our scientific advisory board, including Professor Dan Russell, who co-developed the UCLA scale, which is today one of the standard measurements for loneliness. You go through a series of questions, which are taken from UCLA questions for loneliness, unhealthy days for quality of life, which is a CDC measure, and PHQ and GAD for depression and anxiety, all of which create a social health baseline. So as you join, we have a pretty good idea of where you are on the social health spectrum. Are you mildly lonely? Are you chronically lonely? Are you severely lonely? Why are you lonely? All these questions are answered through the assessment. And then on a monthly basis, as we continuously suggest to you peers who've been in your shoes that can be helpful and available to you, we invite you to retake that assessment so we can, again, get a better idea of whether we're helping and whether the engine is connecting with the right people. And if not, we can make an adjustment and kind of try to prevent you from sliding down the loneliness scale. Those two things, I think, are what we found to be the most helpful and dramatic in producing some really good results. And for the past few years, we've been engaged with some very large health organizations in improving our impact. Happy to say that we've been able to prove our impact with both an older population, so Medicare Advantage, seniors, older adults, and also a Medicaid younger population, because I think all of us intuitively know that social health and community is something that we need from being an infant to being a senior. But it was still encouraging to see that in the data.
That's wonderful. Let's talk about each of the things you mentioned. One is the matching and intervention itself, and then the measurement. Tell us a little bit more about how the experience is. I'm assuming this, as you mentioned, it's one on one. So people have conversations with other folks who have been in their shoes. How long does typically the conversations last? Is it one off? Is it a continuous relationship? What is the experience like on both sides? And also, are the folks on the other side also consumers? Why do they do this? Yeah, tell us a little bit
Yep.
more about the internet.
I'm happy to. One-on-one is one of the forms of communication that people can have with other people. It's not the only ones. There are also groups, groups that are run by professional coaches who are experts in social skills. So to answer your question, once you've done the assessment, you've indicated where you identify the gaps. You've indicated within those gaps what are triggers that you've experienced in the past, what are triggers you're experiencing now, what are some goals that are more positive and aspirational in nature that we can help you try and achieve. And then lastly, assessment, you come into Wisdo to try to build up your social health. From that moment onward, we do suggest one-on-one connections to people that you're going to be invited to, explore their profile and make a decision about whether you want to connect with them. But also, we would invite you to join groups where, again, people in those groups would be ranked by how similar and how helpful they've been, how similar they are to you and how helpful they've been to other people on the platform.
Is this data
Sure.
visible to the users that who has been how helpful, etc., or something?
Yes. So that is, yes. So that is one thing that we, in the 2, 3 years that we spent building this product, it took many iterations to get here. One thing that we found is that when you recommend someone to someone, you need to explain why you're recommending person A rather than person B. So we actually say, here's Sarah, you and Sarah share 15, what we call been there or there now indications. Or you and Boaz, this person that you've never met, but guess what? You and Boaz share 56 of these indications. So I was, when I tell our story, sometimes give the train analogy. I mean, imagine you're on a train, you're going somewhere, and someone comes along, sits in front of you, and you start chatting. And then suddenly you discover that both of you are parents, or both of you are veterans, or both of you, unfortunately, maybe have lost someone that you love. The higher degree of similarity, the more meaningful conversation you're going to have lasting the entire train ride rather than sitting with someone who's very different from you. Yes, to your question, we do reflect the degree of similarity as we prompt those connections. To your question about who are these people that we're connecting people to, so these are what we call helpers. The first layer of support are peers, people who've come into Wisdo at some point and have exhibited engagement and helpfulness level that really sets them apart. So they're the 10%, 20%, 30%, depending on the population and the age group, that have this innate ability to be more helpful to other people. And we all know these people in our lives. We're able to identify them and then invite them to go through a training program that we've comprised, again, with the same Professor Russell that I mentioned before. After which, if they do graduate, they get a helper badge, which is visible to other people on the platform. And every helper, non-helper conversation ends with the non-helper being given an opportunity to rank the quality of the conversation, which is how we can maintain a high degree of helpfulness within that layer of especially helpful peers. So that would be the first layer of support. The second layer of support is group coaching. So we do have coaches who are not peers. These are people who are certified coaches with 5+ years of experience in coaching in group setting for social skills and social health, who run weekly sessions, which are video sessions rather than text, which is the predominant medium of communication for other people on the platform, mainly for safety reasons. We want to be very close to what people are saying and want to be able to identify when someone is using language that we want to maybe intervene and tone down, because moderation is a very important part of what we do. And then the third layer of support, and this is something that we've really heard from our clients that they view as a differentiator, is all these been there, they're now triggers that people indicate in huge quantities, by the way. But we're talking about hundreds over a period of a year, because people are told, and we explain to them that the user experience then highlights the idea that the more you are specific about why you're lonely, the stronger the networks that we would be able to provide to you. So people are incentivized to be very specific about what they indicate as they use the platform. What we've heard from our clients is that this is also an opportunity to solve a third problem with people who are lonely, which is engagement with healthcare. So we work with our clients on essentially mapping out the services that they have to what people are indicating. So if someone is indicating as they're now on, say, noticing depressive symptoms or developing sleep problems or having nutrition issues or many other, we have hundreds of indications, which you also map to ICD codes and Z codes, which is a growing interest in healthcare. We can also prompt hey, did you know that as a member of Plan A or an employee at Company B, you can also get access to a free teletherapy session or a sleep improvement problem or nutrition improvement problem that these companies already have, but they're not having an easy time in making sure that the right person at the right time is navigated to the right resource. So that would be the third layer of support, which kind of ties it all together.
There's so many incredible product nuggets in that. I've always wondered the same way we have wired in insecurity and judgment in social media. Can you actually wire in kindness and helpfulness?
Hmm.
Because not all peer pressure is bad, right? If you see others being more helpful, do you have higher probability of being helpful? And so it's a very powerful thing to be able to say, hey, I am going to show how helpful you are to others. And also, it's
Hmm.
a reward, right? It makes you feel proud of yourself. I haven't seen any other platform do that. It's a very interesting idea. The layers of having a buddy, having a group, and then having a health system support you is also
Hmm.
quite comprehensive.
Thank
A
you.
little bit about the results. It seems like you're one of the few people I've talked to who have thought really deeply about measuring impact, especially in the social space. Most social
Hmm.
companies don't think of health outcomes as their primary measurement. So yeah, how have been the outcomes? What has worked well? What has been a surprise?
Yep. I have to give credit to the partners that we work with who, as you said, met us early in the process when we were a direct to consumer platform and then helped us add the layers of assessment that health organizations care about. So there was a learning curve there that I think was critical to doing this in the proper way. We were also referenced by the Surgeon General in his May 23 report. I think we were one of a very small group, or the only digital health company that was referenced in his milestone report about the loneliness epidemic, because we took the time to prove our impact, or at least use the right assessment to make sure that we're moving people in the right direction. So, to your question, our KPIs are loneliness. So, we use the UCLA scale. The milestone that we're focused on as the immediate kind of goal is 90 days. So, we want to reduce loneliness significantly by the 90-day mark. And we've seen a 58% reduction in loneliness by day 90. Loneliness, for those of you who don't understand, don't know, the loneliness scale is 0 to 9 score, where 0 to 3 is not lonely, 4 to 6 is lonely, 7 to 9 is severely lonely. So one thing that we focus on is reducing loneliness and hopefully moving you in the not lonely bracket, which would be the best proof of impact. Then the second is unhealthy days. We were able to reduce unhealthy days by a whopping, pretty amazing what social support can do, by 10.2 unhealthy days within, again, day 90, where, again, for those of you who are less familiar with this assessment, unhealthy days is basically two questions that people are asked in the past 30 days. How many days would you define as mentally unhealthy? And how many days would you define as physically unhealthy? And there's a very wide and broad body of literature who ties this assessment, which is subjective, which is self-reported, to actual improvements in health and also actual reductions in medical costs. So that is why large healthcare organizations tend to view this assessment as something that is worth gathering. And then the third is PHQ and GAD reduction, where we're able to lower depression, anxiety, and substance abuse by significant measures for a Medicaid population, which is a population that we've asked those questions to. Currently, we have a very large ongoing relationship with a local nonprofit, an amazing nonprofit in Colorado called Peer Assistance Services, where we're working with them and several state organizations to sponsor thousands of Coloradoans a year. And people are asked PHQ, GAD, and substance abuse questions as well. So that is how we measure our impact. We published our results, which is something that I urge other companies to do. I think as this kind of space grows and becomes more data driven, I think clients would want to see evidence that this is really helping people's health, as opposed to just generally helping them feel more satisfied with their workplace or plan. I think the conversations that we're having with chief medical officers and other physicians is really becoming more and more, I'd say, uh, thoughtful about how to identify the companies that are making a difference and companies that maybe still have some work to do until they get to that point where they are as effective as solution to solve depression or diabetes or the other problems that have been around for longer than social health interventions. We published our Medicare Advantage white paper. We published our Medicaid white paper. We're just about to publish a peer-reviewed study that summarizes the work that we did in Colorado that would come out in a week or two. And the results are really staggering.
You're reducing loneliness by more than half in 90 days
Mm-hmm.
for your consumer. That's quite dramatic. Um, are, are there measures that are more outcomes based and objective that you also, I think most of the objective health measures take a long time versus self-reported one. How do you think about um, measuring those in addition to the self-reported outcomes?
We do that when we have an opportunity to rely on that type of data when it's provided to us by our partner. We are a HIPAA compliant, SOC 2 compliant solution m- most of the data that we have is self-reported, and we want to protect people's privacy as much as we can. But we do have relationships where we are provided with some of those indications. We've worked in the past with companies who actually looked at claims analysis data and saw some very encouraging results that I think would benefit from a larger sample still. But I think medical cost reduction is going to continue to be where the rubber meets the road. Because at the end of the day, if you're going to expect a company to pay you per member, then they will need to see an ROI. They would need to see that you are able to reduce medical costs by 3x, 5x, whatever, against what you're asked to be paid. So that is the type of data that we try to get to. Sometimes we have it, sometimes we don't.
Yeah, and I think also there's plenty of studies in the last couple of decades, larger studies that have shown correlation of loneliness with admissions rate and
Hmm.
diabetes and dementia. One of the things that I'm intrigued to hear is, where did you find things that didn't work well? Are there
Hmm.
experiences you've had either because it's a shortcoming of technology or because you tried something but it didn't work as you expected? Like, what are the things when you were exploring the space of social intervention that haven't worked?
Yep, quite a few. Let's go down the list. So one thing that we've learned early on, which was a surprise, is that content is not going to solve the problem. I think a lot of companies out there, including us, I don't want to claim to be smarter than anyone else. It's just a matter of trying. I think many companies out there assume that if someone is lonely or someone is going through a difficult moment, then if they read an article about what to do to feel better, or they watch a video or get access to content, or someone is going to explain to them what to do, that's going to help. What we found is that it doesn't help at all. People have no appetite for content consumption. What they're looking for is a sense of connection. That is one thing that I urge people to think about. The second thing is that when you try to get better at connecting people to people, people are not going to um, find a sense of connection on their own merit if they're lonely. So again, when we started, it was okay. We have all this really great data. We know where people have been through, where they are now, where they want to get to. Let's have them do the onboard, and let's tell them, hey, now that you're here, are all these people that you can connect to, and they're going to make those connections and be proactive. What we found is that yes, there will be a percentage of people who do that, and 15%, whatever, depending on the population. But you need to be very proactive in making it as least effort driven, or the effort involved in making a connection should be as flawless as you can make it. And that is really where the helpers concept came about, because we said, all right, so let's try, instead of saying, hey, welcome to Wisdo, and now here are all these people. Good luck finding someone relevant. Let's find someone who is especially uniquely relevant and helpful, and have that person reach out to that person who just joined and say, hey, Wisdo connecting me to you has chosen me from the hundreds of thousands of people on this app. So happy that you joined. How can I help you have a wonderful first conversation? And then we said, all right, if we're going to do that, then who are we going to point to people who are joining? And then we said, needs to be the best of the best. And then, all right, so how do we know that they're the best of the best? And then we came up with the threshold of engagement and helpfulness, and the training program that ends up with someone becoming a helper. So I think that's a second thing, because again, you would think that if someone is lonely and they've gone through the trouble of joining the app, downloading the app, building a profile, they're ready to roll, they're happy to make connections. No, they still need you to be much more proactive.
What this reminds me of, so I was chatting with a spiritual leader, and one of the things he said is that I was talking about belonging and how they think about bringing in new members in the community, and especially who are new to the communities, they don't know what the decorum is. And he said
Hmm.
something that was so powerful. He said 80% of our work is done in the first 30 seconds of their experience. It was a physical temple, and what he said
Mm.
was, when you come in, what do you smell? What do you see? Do people turn around and see you and smile, or do they just ignore you? Does somebody
Mm.
come in the first 30 seconds and say hi and we are glad to have you, or they just look at you and walk away? And so he said, so many times we think it is the experience over the next 5 years that matter, but 80% of our work is the first 30, thir- 30 seconds. And I think just reminds me the way you were talking about the first few interactions, and because anybody coming into a space, new space, especially if you're lonely, you're judging yourself and you
Mhm.
think that the other person is out there to get you. It's not anybody's fault. That's how you end up becoming if you've been chronically lonely. Yeah, it's interesting to see the parallels. And also Rotary Club does the same thing. If you want to become a member, the member will actually email you, reach out to you, have a conversation, and then welcome you to the first meeting. Yeah, it does seem quite powerful and also so counter to what we do in Bumble PFF or Tinder, or because you just expect that people will do a cold start almost all the time. Yeah, but please carry on. The two you mentioned resonate, but are there others that you learning from?
I can also say that when we started our first big study, which was a 1,500 population study, was with a Medicare Advantage population. And when we started the Medicaid relationship in Colorado, which is a younger population, the average age there is 38, we had this conversation, which I think many people have is, yes, loneliness is an older adult issue. But if people are younger, then they're probably less lonely because they have family, they have work, communities, et cetera, et cetera. The ratio of loneliness is higher in the 18 to 65 population, but 72% versus 40% in the older adult population who are lonely. In fact, the percentage of people who are helpers in the older population is closer to 30% relative to 15% in the younger population. And that obviously influences the percentage of people who end up feeling A, lonely, and B, are able to move out of loneliness. Because as you said earlier, altruism is a textbook intervention or opportunity to give people who are interested in building up a sense of feeling more socially supported. So we were surprised by how lonely people are in the younger age groups. And our scientific advisor, Professor Russell, is now doing work on adolescent population in Iowa, people who are 15, 16, and we're 18 plus out. So I'm saying this even though this is not a population that we're going to take on for the time being. But he says that the studies that he's seen and the data that he's seen around people who are now in their teens is loneliness rates that are higher than
Wow.
people who are 18 to 65. I was surprised, and maybe this is because I come from a country where community is very strong and family ties are very strong and very robust, and people who are productive and at work tend to be people who are surrounded by support. We were shocked to see the loneliness rates for people who are in their 20s, 30s, and 40s. And that continues to be a source of amazement. I think the challenge with older populations obviously is tech adoption. There we were surprised by how tech savvy the older population was. We actually did a webinar with ARP and United Healthcare a while back, and they showed some staggering statistics about tech adoption and tech savviness, particularly mobile tech adoption with people who are over 60, which isn't very surprising when you think about it because social media has been around for 2+ decades. People were in their 30s and 40s when they started and now in their 60s. So this is not something that they're not comfortable doing. I think the challenge there is from a recruitment point of view, how do you close that circle and how do you become an end to end solution? And what I mean is, I think our challenge as companies, we build these amazing products and spend a lot of time in making sure that if someone joins, then they stay on and we're able to prove impact. But what's going on in the mind of the company that you're going to start working with is, but how do we get people on the platform? And that has consistently been a really big challenge. So I think what we ended up doing, and I think many companies will have to maybe think about that as well, is become an end-to-end solution. So you have to become great at activation and recruitment and treat that as part of your product. So it's not a hi, we're company X. Once someone joins, they're going to have a great experience. Hi, we're company X. We know how to reach out to your members. We've learned that there are different messaging to different groups where you will deploy the following activation statistics that are relevant for this population. IVR is something that we've used for an older population, which is automatic voice calls. Surprisingly effective. We're all biased against these calls. An older population seems to be very seems to resonate with this recruitment tool. So yes, we know how to do that. And if it's the work that we're doing in Colorado is a social media driven activation. So for people in Colorado, we know how to run ads who will bring in people from Colorado in the age group that you're interested in, because that's where people are loneliest, frankly, when they're on Facebook or on Twitter and TikTok. All these are great apps for people who are interested in making just ongoing connections. They're not great apps if you're trying to measurably reduce loneliness. So we know how to do that as well. That was another surprise to some extent, that we need to take on recruitment, and we have, and I think other companies will have to do that as well if they really want to make sure that they're ticking the box and what clients care about.
Yeah, no, I think you have to meet where people are, and loneliest people are not really out there. They're probably on social media or probably in their home and waiting for a
Hmm.
call, right? I do want to get to the frontier of AI. I think you have been using data and AI in recommendations, etc. Of course, the world has been hit by the LLMs the last 12 months. And I think the line between content and experience is actually thinning, right? Like if you actually call a number and on the other side, you can't figure out if it's a human or it's an AI, what happens, right? A few questions. First one is, can LLM in your mind substitute human connection? I think we are talking about AI friends, AI coaches, AI therapists, especially in the digital world, experiences through our devices.
Hmm.
What is your take on that?
It's all a question of the famous Turing test. And do we really get to a place where we cannot separate the experience of talking to a human and talking to an AI? I don't think we're there yet. I think it's going to take, I have a maybe unrealistic view of the value of human connection. And maybe we will continue to be surprised by how AI is able to mimic human interaction, even in a situation where it's a one-on-one conversation or one-to-group conversation, and unexpected conversation pattern, et cetera, et cetera. If I was building that type of AI, I would ask myself whether that type of interaction can answer what humans have identified as the fundamentals of a conversation that can move people to significant reductions in loneliness. And then if the AI is able to provide those, which are emotional support, sense of worth, a sense of belonging, and the understanding that you might be able to help, not only to be helped, then potentially yes. I think that there's a question that should be asked before the question of, can we design generative AI and language patterns that can mimic that type of intervention or that type of conversation, which I think, um, if we don't solve that question effectively, then the other question is not going to matter, which is the question of profiling or question of profiles and clustering. I think what we've learned is that what ends up happening in the actual conversation is very important. But what is even more important is who's talking to who. So if I came in and I'm lonely because of anxiety, and my loneliness baseline is 4, and I've experienced 5 unhealthy days in the past 30 days, and I have mild anxiety, and my goal is to start to exercise, I'm gonna have to talk to people who are different than someone who has a completely different profile. So I see a lot of energy going into what happens in the actual conversation. What we're trying to get better at doing is understanding again who needs to be on the other end of that conversation for measurements to reduce most significant, because that is what we found to be um, most effective. I haven't seen a lot of work in that direction so far, AI wise. You're talking to an AI, or hi, this is Sandra, or this is John, or this is Steve Jobs, and it really sounds like that person. But again, the science of social health is the magic is in the matching. And I'm looking forward to continue to see where technology advances in that context.
I think this is one of the most nuanced answer I have gotten. I think most
Mhm.
people are still grappling with the idea of talking to AI. I was as well a few months back, and then I tried to actually have conversations with AI on my emotions and being a parent. I think it can be useful, and I think it could, if done the right way, it can actually make you open to talking to more people because it's practice. If you've been vulnerable, if you've talked about your feelings to one person, you're right. I think it's not a slam dunk that no, it should not replace or substitute human connections, or it should. It's more so on how we use it and for what roles, and how do we design it such that it works in an intended way and not create another social media where the goal was
Mhm.
something else and
Mhm.
outcomes were not even predicted. We didn't think. Thank you for the amazing conversation. We are at time. I know. One last question, and this is a fun one before we close out the discussion, is what is your
All of it was fun. All of it was fun.
I hope this is one of many conversations. But yeah, the fun question is, and I ask this to every guest that comes on the pod, is what is your favorite social connection ritual?
Social connection ritual. Um, so we have, this is going to sound strange, but we have a ceremony, almost a ceremony, a weekend ceremony, which is called 20 Questions. Haaretz is the kind of the New York Times of Israel, or Hebrew readers. And every Friday they published 20 questions, which are really hard, almost designed to make you feel especially stupid. So when Friday comes along, part of our weekend ritual, and sometimes it's family, sometimes it's friends who come to dinner, is to go through the 20 questions and see if we can break I think our record is like 11. These are really hard questions. And it's always really fun because you somehow try to collectively become smarter, and everyone's knowledge is a little bit different. One person is really good at sports and another person is really good at geography. And suddenly, as a small group of people, you become smarter than all of us individually. So that would be ours.
Yeah, I'm going to steal that one for my weekend, this weekend's get together with friends. I'll have to check this out. This sounds fun. Awesome. Any closing notes to other loneliness busters who are seeking to create a more connected
Yeah, keep at it. Keep at it. And we're doing something really important and very timely. There's a lot of interest in the space from funds and from companies and from clients. But at the end of the day, we want to help people. Excited to be on the forefront of these attempts, as you are and other companies are. And let's remember that we can support each other and pool our resources and wisdom and try and solve a very big problem.
Thank you so much. If you're still here, thank you for listening. If you enjoyed this episode, please subscribe to the podcast and share it with a friend who you think should join the Loneliness Busters squad. See you next time.